Hello and welcome back to another episode of the Help Is Here podcast. Earlier today I was talking to someone who had spent a lot of money on therapy, a lot of money on some group coaching programs. And I want to share today why I believe that these things may not be working for people. And yeah, we obviously have our own program. We obviously have our own group coaching. So you may listen to this and be like, oh, you're biased, whatever. But I'm actually going to be talking about this really from a methodology standpoint, like from the perspective of understanding different parts of the mind, understanding like the beyond compulsion method. And hopefully this will actually like provide some insights to you. You know, if you've been in therapy or you've been in some other group coaching programs and you're still relapsing to porn, which a lot of guys are because like so many guys we work with have been in that position, this is going to be a good one for you in particular. So this guy on the phone to me today, what did he say? He said, hey Tom, you know, I was doing quite well and then I had a slip up. I was quite stressed at work. And it's like, to me right away, I'm just like, wow, like we are talking two different languages entirely. That kind of way of thinking is quite common amongst like therapists and other group programs, but like it really, really does not align with what we teach at all. First of all, the idea of slipping up, you know, if you've been around here a while, you know we really don't like that kind of language. We're never going to like judge someone for using that language. It's not the person that's the problem here. It's the misinformation online and the sort of conventional approaches towards addiction recovery, which I've got a bit of a problem with because I tried all that stuff and it didn't work for me either. But yeah, the idea of slipping up is completely based in helplessness. Like, you know, imagine actually like walking down the street and slipping up, like you're fully out of control. If you apply that same principle, that underlying concept to addiction recovery, it is just fully feeding the addicted part of the mind that wants you to be helpless, that wants you to feel like you're just acting on autopilot and that you don't have control over yourself. But the truth is, it is possible to have complete control over yourself. And that's what we train people on, which is why I don't like the idea at all that people are slipping up out there, because it is just bullshit. That is complete addictive thinking and it doesn't happen. You know, it just doesn't. No one slips up and ends up on like a porn site. Like it's not a thing. It's just a language that has become normalized, unfortunately, in this space. The second thing is, you know, oh yeah, it's because I was stressed. And again, like within the beyond compulsion methodology, this is something we would really strongly disagree with once again. And it's super common within like group sort of environments that are trying to deal with this problem. The reason we wouldn't like recommend thinking about relapsing in terms of like something like stress is that it just, again, it puts you in like such a helpless, powerless position, because stress is something that most people experience at some point in their life. And so if you believe in if you have the belief system that when I'm stressed, I'm going to watch porn, or that your stress can cause you to watch porn, you're kind of screwed. Like you're setting yourself up for failure, because the truth is, there is nothing in this world that can actually cause you to relapse other than really your own mind, like the addicted part of your mind and like the way you're thinking about things. Like the only thing that really causes you to relapse is the addicted part of your mind. And that isn't caused by stress. That's just caused by the neural pathways of compulsivity and the fact that you have a part of your mind that wants to engage in a compulsive behaviour. And that part of your mind that wants to engage in a compulsive behaviour is going to want to engage in that behaviour regardless of any emotion, whether it's stress, loneliness, any other challenging, difficult thing in your life. And what happens is that part of your mind, the addicted part of the mind, is going to basically blame the relapse on some kind of thing like stress to keep you trapped in the cycle of addiction. And here's the thing with therapy and group coaching is they rarely understand that there are these different parts of the mind, that we have like the rational part of the mind that wants to stop, and we also have the addictive part of the mind that wants to engage in the compulsive behavior. And if we don't understand that the addictive part of the mind wants to engage in the compulsive behavior, and we go along to a group coaching session, or, you know, and we go see a therapist or whatever, and we're spewing all this nonsense that comes from the addictive part of the mind, which is going to happen. Like when I first did the beyond compulsion method, I was like literally just chatting the most shit possible. Like I honestly was just spewing so much junky thinking. I had so many unanswerable questions, and I was just saying all of this stuff to Mary, And if she didn't know exactly how to deal with the addictive part of the mind, she would have probably just validated my way of thinking and been all like, oh yeah, you're right, Tom, you know, it is normal, it is fine, yeah, it's not that big a deal. Oh yeah, you're right, it is okay if you only do it once every few months. Like, that's what a lot of group programs or maybe like therapists might do, is just try and validate the person in the addiction's way of thinking. But really, that way of thinking needs to be challenged. It needs to be addressed. It needs to be changed if we want the long-term results. Like, if we want freedom from addiction, we can't continue thinking in the same way that has led to us being in an addiction up until this point in time. That isn't going to work. And also surrounding yourself in a group environment with other people who also have junky thoughts and unanswerable questions, and they're all just spewing this addictive thinking. It's just a recipe for absolute disaster. And I think that's why like no-fap forums have such a low rate of like long-term success, and why like, yeah, you see a few guys like on a long streak, but like most guys eventually relapse. And I saw this in a lot of the porn addiction communities I used to be a part of in the past as well. And like there's just so much helpless thinking, and like it's just understanding there's different parts in the mind and having someone assertively correct that thinking. And that's why, like, on this call earlier today, I don't know if I pissed this guy off or not, but I was like, man, like, come on, like, this is just bullshit, like addictive thinking going on. And there's nothing wrong with having that addictive thinking. We all have it. Like, I have that thinking at times. Like, this is the amazing thing, is like, I'll have that like really irrational way of thinking that comes from the addictive part of the mind. The only difference between me and, you know, someone who's still struggling and relapsing is I know how to deal with that addictive thinking now. And I just use a very simple 5-fact script. And that's the only difference between me, my clients, and like everyone else struggling with this problem, is we know how to deal with the addicted part of the mind. Like, that's the only difference. So we all have that thinking. The thinking's not the problem. Like, the compulsive desires is not the problem. There's nothing wrong with you or me or anyone else for having like desires or sexual desires or compulsive desires. Like, there's nothing wrong with people for having all of that stuff go on. It's how do you respond that matters. And then the second thing I want to talk about, so that's the first thing, is like the inability to deal with the addictive part of the mind. But the second thing is what can happen with like therapy and group coaching programs is they can often rely on the sort of accountability, and accountability won't get you anywhere with a porn addiction, because what happens at 2 a.m. in the middle of the night, if you wake up with really strong urges, like, what are you going to do? Like, call your therapist? Like, call your accountability buddy? Like, if there's no group meeting on at that time, it isn't going to get you anywhere. And so that's the thing, is that there's going to be an inevitable moment of compulsive desire. Like, you are going to have the desires. And as I say, there's nothing wrong with having the desires. It's how we respond that matters. And so you need to get trained on dealing with those desires independently for yourself. Like, even with our clients, sometimes they'll be having quite strong desires and they'll be having like junky thoughts, unanswerable questions. And if they start messaging us, often we have to just tell them like, hey, go use your script. Like, messaging us isn't going to empower you. It isn't going to help you, because then you're just relying on someone else to try to do the work that you need to do for yourself. You're the only one in the world who can truly get yourself out of a porn addiction. Even with our program, like, if you don't then apply the method, you're still going to keep on relapsing. Like, it is 100% down to you when you really break it down. Whether you learn our method or you don't, it's always going to be 100% down to you. And no group coaching program, no therapist in the world can actually get you out of a porn addiction. You actually have to do it for yourself, and you're the only one who can do this. So I just want to get that across. Hopefully this helps you. Thank you for listening. And if you would like my help, then feel free to take the compulsion test. You'll get a free score out of 100. You can better understand how much this problem is impacting you. Cheers for listening again, and we'll see you in the next one. Goodbye.